Hi, I'm Sharni Wilson-Smith from EFM Health Clubs. I'm the franchisee from EFM West Lakes, and I'm here to speak to you today about diabetes. Now, this is one of my pet areas. I actually am involved in running a diabetes or a pre-diabetes specifically course, so this is something that I love to talk about. What we're talking about today is diabetes, and as you've probably heard, there are two kinds, type 1 and type 2 diabetes. Type 1 exists in about 10% of cases around about. It's an approximation, and it's an autoimmune disease. That's not the one we're going to talk about today. We're going to talk about type 2, or adult onset diabetes, it's sometimes called, which is about 9, which can exist in about 90% ballpark figure of diabetes cases. And the reason we're talking about that one is that it's lifestyle related. In fact, 60% of type 2 diabetes is thought to be preventable, which means it's something you can certainly have an impact on. You don't need to just sit back and wait for it. So you may have heard the term diabetes epidemic that's been bandied around. We're currently described as being in a diabetes epidemic. And the reason for that is that diabetes is our fastest growing chronic disease in Australia. The numbers are quite frightening for diabetes, for type 2 diabetes. It's thought that about 275 Australians a day develop diabetes. We're looking at about 1.7 million Australians are currently diagnosed or thought to have diabetes. And if we take pre-diabetes into account as well, that brings up to about 3.2 million people in Australia. The cost of that, let's put these into big numbers, the cost of that on the Australian population works out to about $10 billion. So if we put that into context, guys, that 60% of those cases are preventable, there's about $6 billion less tax that we have to pay. So get into your gym and let's get that sorted out. So diabetes is thought to be the 6th leading cause of death in Australia, so it's has a very significant impact on mortality, but it also has a significant impact on quality of life. So this is something that we should all be thinking about and fending it off. So what is diabetes? Well, diabetes occurs when the pancreas, which is one of the organs of your body, is no longer able to produce enough insulin, or insulin becomes ineffective, or sometimes that's called insulin resistance. Insulin is a hormone that your body produces, and its job is to help the cells of your body to take up glucose. So when that isn't happening, or when your body isn't able to produce enough insulin, that means that your blood sugar elevates. Now the side effect of that is that high blood sugar will result in vascular disease in the long term. And vascular disease means you'll experience things like kidney damage to your eyes, that's one of the well-known side effects of diabetes, and numbness in the limbs and extremities is a really common one. And we've all heard tales of people who've lost limbs or toes or fingers as a result of diabetes. We don't want to be in that situation. The other side effect, of course, is the risk of cardiovascular disease. So when you are diabetic, it significantly increases your risk of cardiovascular disease. So how do you know when you're at risk? What are the things that you should be looking for to think that you might be in the risk category for diabetes? Those are all those familiar things of, number one is family. If there's a family history, that does increase your risks. Being over the age of 55 increases your risks as well. So unfortunately, age does relate to the risk of diabetes. Body weight, of course, being one of the important ones, particularly carrying weight around the middle of the body. Having high blood pressure will also put you at risk. If you were unfortunate enough to have gestational diabetes, so if you had diabetes while you were pregnant, or you had a baby who was over 4.5 kilos, that will also increase your risk. Or if you are currently diagnosed as being pre-diabetic. So pre-diabetic means you're not in normal blood sugar, not yet high enough to be diabetic, but somewhere in the middle. So those are all the things to look out for, and if any of those ring bells, that means that you could be at risk, and that might be time to have a chat to your doctor. So what are the symptoms that we should be looking for? The things that we look at for are the 3 T's when we talk about diabetes. And the 3 T's are being tired, being thirsty, and needing to go to the toilet a lot. So being tired is because your body can't take up glucose into the cells. So glucose is what we use for energy. If you're not getting energy into the cells, you're going to feel tired. Second one is being thirsty. So if your blood sugar levels are high, your body's going to try to dilute that by triggering the thirst mechanism. That, of course, results in needing to go to the toilet a lot. If any of those ring a bell, guys, then it's a very strong chance that you could be diabetic or at pre-diabetic stage. So it's worth getting into your doctor to have that checked out. Now, how we diagnose diabetes has to be done through your doctor with a glucose tolerance test. Very easy to do, not painful at all, but certainly worth doing. If it turns out that you do have diabetes, then there are ways that we can manage it, or pre-diabetes as well, that we can fend it off. Regardless of whether you do or don't, all these steps are very smart things to do for a better lifestyle in general. And those steps are, of course, quitting smoking, another one. Again, we want to quit smoking. Alcohol, keeping your alcohol intake to a lower level. So that means 2 serves a day for men, 1 serve a day for women, and a couple of alcohol-free days a week. Having a healthy blood pressure and healthy cholesterol are of course important. Keeping your body weight in the right place, and last but not least is exercise. Now exercise is crucial for improving your body's ability to have functional use of its insulin, and of course it will also help you to use up extra glucose from the system, so it increases or brings your blood sugar to a healthier level. The target for exercise for diabetics is about 210 minutes a week, so that works out to about 30 minutes a day. Not an excessive amount and certainly achievable. The other thing that we're looking at is strength training, which can be built into those 210 minutes. And strength training has been shown to be extremely effective in treatment and management of diabetes and pre-diabetes. So those are all things that we can do at your local EFM Health Club, so get in there and find out more.